Hey everyone. Let's see. I just read a study probably about 2 months ago that talked about what people's beliefs are about when we crack joints, especially the joints in our spine. What it's doing versus what we actually, on the scientific level, believe is going on. So I wanted to talk about first what we know, which is what happens when we hear the popping sounds in various joints in our body, regardless of if they're spinal joints, the fingers that we have, the wrist, which is one of mine that cracks, my ankle goes all the time, knees, and what is really happening there. So the research that we've done seems to turn up that the sound that is created has to do with the force of the two surfaces being distracted from one another. So essentially think if you place your hands, the palms of your hands very, very close together, very, very tight. Most people tend to get cracking mostly when there's tension. What we do is when we separate, you can actually hear mine pop right there. That sound is the two surfaces pulling apart and a gas filling them. In this case, the gas in this room. What's happening with that is we're creating a small gas bubble that then collapses very quickly once the pressure is released around it. So the force of two surfaces being applied tightly together and then separating and doing so quickly, especially when they are done under pressure. So right now I'm pushing hard to get this gas bubble and then creating that expansion. That seems to be what's happening inside all of our joints. We actually have really great MRI results on this, and it's actually kind of cool to watch. When we actually can see the sudden expansion and then the retraction as our body goes through this. This creates what's known as a sustained gas bubble in our joints, which is why I can crack a joint once. I don't know if, there we go. And then it won't do it again for a little while as this sustain needs to relax. It's a little bit different than what we used to think was going on because we thought that the gas had to gather and then that was what was creating the pop. Turns out the actions that create the pops are what creates the gas bubble, and then it has to dissipate over time. Kind of a neat little thing. However, what we're doing as well as we do that is in order to create a situation that would create such a gas bubble pop, we are putting ourselves under a amount of tension and then doing a very quick stretch. What we have found is when we do any sort of quick stretch at a joint, it also has a neuromuscular effect. That neurophysiological effect we get can do quite a few things, but in the case of a lot of people, that sudden sustained pressure and then quick release provides a sudden relaxation cascade in a lot of the different chemicals in the region, essentially effectively turning off a whole lot of the tight muscles. This is one of the reasons that when you have a tight back, it feels so good to pop it, is because that pressure that it takes in order to get the pop and then the quick stretch that actually creates it is going to send a cascade out that allows all the local muscles to turn off, which is really, really nice. Now, this is a little bit different than what we used to think was going on. For many cases, we used to think that we are realigning joints, or in some cases, we used to think that something was dislocated and we were relocating it. We found out, thankfully, that that is not the case. Again, we've talked about this in the past. It's a scientific belief that based off the evidence we had at the time, it seemed to make the most sense, but as new things have been revealed, we found out that's not what's going on. Now, that's absolutely okay, as long as we're willing to make that acknowledgement that, oh, I was wrong, I need to change and update what I'm doing and re-explain how things are happening. So, what is this good for then? What should I be doing when I'm trying to cavitate someone and create this nice popping sensation? Well, I need to look at which patients are then going to give me the best results for this. All right, if the main physiological effect of this is that it's creating a sudden relaxation, I need to find someone who's going to benefit from sudden relaxation, and that's going to solve the problem. Because the majority of people build that tension up for a separate reason. For people like myself, a lot of the times tension built up in this region is related to physiological stress. Sometimes it's overwork of these muscles, which is usually my case. Other people, it's work-related or family-related stressors that are causing them to guard up. So while I could potentially very quickly crack and release all of that pressure, it's going to build back up if I don't relieve the cause of it, which in this case we know is tension and stress, whatever's causing that tension. Often either physiological stress or psychological stress. Same thing can happen if people have poor postural support. So very often one of the things that we will find both in our office, another office that you'll see us done in is a doctor of osteopathy or a chiropractor. Those different groups of us will all take a look at some very similar things, and very often what we find in people who feel the need to be cracked frequently is that they have some postural deficits, especially endurance deficits. So, the muscles that are required to hold me up, the ones back between my shoulder blade here, often undergo long periods of use. We have to be upright throughout the day. However, if we're not doing regular resistance training to keep the tone and energy up in those muscles, they become less able to support us. A tired muscle becomes tight very quickly. You can see this after going for a run. You'll feel your legs have tightened up when they feel that they're most exhausted. And if you ran further than normal, even the next day, sometimes you'll feel relatively tight. You can imagine the toll this takes on our muscles that we're chronically using throughout the day if we're not conditioning them to be used in that manner. This is what we most often find, is that people who undergo endurance training to their postural muscles when they have postural deficits like this tend to resolve these issues over time. Now, it doesn't mean that you can't pop yourself to get a little bit of relief, but the stressors that we're undergoing, if it's continuing to be part of our life and part of our day and we're not resolving the root endurance deficit, are going to keep coming back. Now, that's not to say that this is the cause of all people's back pain. It is a common cause we see in people who aren't active in creating really good physiological stress, which sounds strange, but good stressors that we do infrequently throughout the day, so exercise, are what allows our body to build and adapt. Versus a chronic stressor, something that goes on throughout our day without rest, is something that is going to wear us down. We need to make sure that we're applying enough of the good stressors, the short-term workout type things that are allowing our body to build, that our body will build, and make sure we're taking enough time off of the stressors that are causing the problem. So whether or not it's making sure you get the help you need to decrease your stress, whether it's looking at something that's clearly overworking you and backing off of it, those are going to be better long-term solutions. Now, you can use the short-term solutions. Things like massage would work just as well for relaxing these muscles, as well as some of the different modalities we have. Things like electric stimulation, application of heat. These things can be very helpful in short term, and there's nothing wrong with using them. But it's important to know when and why. So, if I'm not realigning my own spine, okay, well that takes this out of the picture in terms of what I am actually doing to my body. But then, if it still feels good, I also need to know, alright, so it's the relaxation that's helping. Why is it tight in the first place? And what can I do about it? Very rarely is tightness caused by lack of stretching. Sometimes lack of active range, so people who stay in one position throughout the whole day and don't move from it frequently, and their lifestyle then doesn't demand that they do frequent mobility, can definitely be affected by things like that. But more often, lack of flexibility has to do with fatigability in muscle groups. Not so much that, oh yeah, you're not hyper stretching enough, but rather, okay, either you're not doing enough activity throughout the day for your muscles to be able to support what you're doing, or you're staying in one place so much that your body's not getting the variety of movement to know it should maintain that level of loose. Muscles don't get tight. We've talked about this in the past in terms of actually shortening. These fibers within our muscles slide along one another, and our nerves are what tells them how far into extension they're allowed to go. So if I can't extend my arm because my biceps is limiting me, that is because my nerves are telling my biceps not to go beyond here. However, if I can help this muscle group relax, I can then gain extreme range of motion in a very short period of time, which is fantastic. Because that's usually what we're going for, trying to get this range of motion back. Now, one of the things that people worry about is, okay, well, if that can loosen my neck up, my neck is really tight, but I'm afraid of getting cracked. Do I have to do it? No, thankfully. There are other ways to activate a very similar relaxation cycle. Like I said, massage can be extremely effective to people with tightness in this region. There are some other more proprioceptive techniques that we can use that just involve some light resistance and active movement. And actually general exercise, because of the resistance and active movement involved, can help release this area as well. We call it exercise-induced analgesia, or the ability to reduce pain by exercise. It's kind of a cool little thing we've learned about the body, is that we don't have to take just one approach in the majority of situations, and we can do one that fits you best. And the ones I like to pick in my clinic are the ones that tend to be the ones that induce the least fear and produce the best long-term adaptation. So, we talked about how exercise can be the solution to people with fatigability or with tightness due to immobility. We also talked about how exercise can induce analgesia, decrease our pain, and increase how loose we are. That actually tends to be my favorite modality then of treatment, is, okay, this can address 3 different areas all at once. I want to get this as involved as I can in people's lives. So, you'll notice in our clinic, most of our treatment, while we will still do hands-on manual therapy, tends to be more related to the exercise aspect, and that's why. It gets more things, more bang for your buck in that period of time that you're here, where I can get some decrease in our pain, some increase in mobility, and I can start adapting your muscles long term, as opposed to having to spend a little bit of time of exercise, a little bit of time trying to decrease our pain, and a little bit of time using something else to try and increase our mobility. If I can do all three in one group, it gets me a little bit more out of it. So that is the base explanation we know of for what cracking actually does, and of course, why I might want to do it, and what are some of my alternatives if I don't feel comfortable with it. Thank you all for tuning in. We'll talk to you soon.